I'm going to put my foot in the lion's mouth and stick my neck out. I'm going to give you some data and then ask you. The listed hospital industry, we take the turnover of 7 or 8 combined hospitals. You find that they recorded in FY23 the highest capex ever in the past decade. And they are projecting an 8 to 10% revenue growth in FY24 also. The Q1 FY24 was very good. For the first time, it was almost equal to Q4. Narayan Hridayalaya reported the highest ever revenue on a quarterly basis. So did Max Healthcare, so did Shanti. Apollo Hospital saw a 16% growth in Q1 FY24 over FY23. Aster Hospital, DN Healthcare 21%, Fortis 13.4%. These hospitals are getting more and more aggressive. They also have business models. They have CEOs from IIM Ahmedabad, etc., running the hospital. How will this impact the smaller and the medium hospitals?
The number of hospitals you're talking is 4 or 5 or 6 hospitals.
They have a chain.
Chain of hospitals. So you need to understand India is a very different. The population is huge actually. None of these hospitals which you said are in tier 2 town. They're purely in tier 1 town. You have to understand that actually the growth is happening only in tier 2 towns. Tier 1 town, the growth is maximized actually. The growth potential is very high in tier 2 town, where these hospitals are not gone. Our story is different. We started in a tier 2 town, we came to tier 1 town for expansion. Whereas tier 2 town, that's why I was telling that most of the small and medium hospitals are in tier 2 town. Don't worry about this Goliath actually, okay? Don't worry about this Goliath. See, it's a very big cake. I keep telling that the healthcare industry or any business is a very big cake. Everyone can have their own piece. The Apollo can have the street, the Max can have, Dr. Sehgal can have, Dr. Manivanan or you, everyone can have their own piece actually. So don't get worried about the big hospitals. The big hospitals keep growing, the smaller hospitals also keep growing actually. But they are not visible. They are not in the public list and they don't come in the media. That's the thing. I feel that both are in different segments. Both are catering to different segment of population. So that's why we have to compare apple to apple. So comparing this, and that's why I told, these are not competitors for small and medium hospitals.
The international tourist has also come back. The smaller hospitals may not be able to get the money or the funding as required for the fantastic machines or the equipment which is coming now. So are we going to say that the smaller hospitals will have a different kind of a patient? They will not be able to deal with very complicated cases because they will not be having the world-class top equipment which is required, and they will be there. So are we trying to say that? Will it be two types of, and are you okay with that? Is it a good idea?
No. See, let's say recently we opened a hospital in Chennai. We spent 90 crores on medical equipments. Few months back we opened a hospital in a tier 2 town in Tamil Nadu. We just spent only 30 crores. Okay. 95% of all the procedures done in the Chennai hospital is being done in my tier 2 town hospital also. Okay. I had a very high-end cath lab in tier 1 town. I had a second level cath lab. I had a 256 slice CT in Chennai. I had a 32 slice CT in this tier 2 town. Okay. I had a fully motorized cot in Chennai. I had a manual cot in tier 2 town. For ICUs, I had motorized cot. That too, Indian motorized cot. In Chennai, I had a Hillrom imported cot. So I was able to equip this tertiary care hospital with 30 to 35 crores. Whereas in tier 1, the same hospital in our group, we are doing 90 crores. Our target population there is different. Our target population. Both the hospitals are doing well. They make the same percentage of EBITDA. The quantum could be different. For the first hospital, Chennai hospital, the total investment is 320 crores. For the tier 2 town hospital, it's 130 crores. It is 1/3 of the investment. So my revenues will be accordingly less, but my profit margins are same. So it is not that we are giving a second class treatment to people in a tier 2 town. No, actually. Probably I may not be able to do a very high end neurosurgery or a cardiac transplant, which I'm doing in Chennai, actually. But those things I'll refer to a hospital which is doing it, actually. Okay. In a tier 2 town, say suppose you are in Delhi itself. You are in a Delhi, you cater to trauma patients, you want to have a CT scan in-house, get a 4-slice CT. For a trauma patient, 4-slice CT is enough. Suppose you get a complex cerebral aneurysm or something, you want to do it, send it to a nearby center or other hospital to do that complex CT. So you need to mix and match. I will say that not world-class equipment actually, okay. It is appropriate technology. I will not say that best class technology, best technology. Appropriate technology. What is required for my patients I will have. Beyond that I will not have.
So what is the minimum amount? 30 crores is not a small hospital. Your smaller hospital took an investment of how many crores? The smaller one?
Which one?
The smaller one.
Smaller one, 35 crores of equipment.
35 crores plus maybe 10 crores, 5 crores more is not really a small hospital.
It's a 150-bedded hospital.
Yeah, but that is a medium hospital. You are no longer a small hospital.
No, I'm just telling you.
Yeah. My asking is, what is the value which you feel, what is the amount, minimum investment required to have a decent hospital, minimum investment required? I'm not sure, I want to put one more point across. Don't you think that India is at a different juncture today? I'm not sure that we can start with a 5-bed hospital and succeed. I think India can no longer take an imperfect model. That was in 1999, 94, when India and the patients were not so discerning. Do you think that India is at a juncture, the Indian patient is at a juncture where he will agree to go to that is fantastic, that's a fantastic story. Not trying to, I'm just asking another question. Are we not at a stage where we will not accept anything less than maybe a 30 crore turnover, which is not technically a small hospital?
No, see, basically one thing you have to understand that depends upon what kind of services you want to offer, what kind of geography you are there, and who is your clientele. Dr. Sehgal Hospital, do you have a CT scan, sir? Yeah, what is the slice of CT scan? 160. Okay, fine. That is a 100 plus slice CT scan. It is in Delhi. In our place, in my town where we started our hospital, there are only 2 hospitals which has got more than 32 slices. Mine is a tier 2 town. Okay. In my town, in my hospital or the other hospital, they do equal number of bariatric surgeries or joint replacements, and we do in government schemes. Most of the high-end surgeries are done in government schemes in our town, in our hospital. But still we make a very good profit. I understand that we can't start a 5-bedded hospital now. For a 20-bedded facility, you can do a fantastic single specialty hospital. Suppose some orthopedic surgeon is there. Or suppose you take a ENT surgery. ENT surgery, most of the surgery is daycare surgery. You don't require 20 beds also, 10 beds is enough. You have a decent operation theatre with a small laminar flow you require actually. Otherwise a 10-bed facility is enough. You have a 7,000 to 8,000 square feet of built-up area is enough to do a single specialty. Suppose you have an obstetrician and neonatology. Neonatology requires a very small area. In a small area of 500 square feet, we can have a 10-bed NICU, a quality, high quality NICU.
So what is the total amount of investment required? Let's say, what of these two? Yeah.
First of all, let me begin at the first question, whether the big fish will eat the small fish. I think I found his example very, very interesting. A dinosaur and a cockroach, and both of them are existing. Maybe dinosaur disappeared, but the cockroach is still there. See, you have to understand. No, but listen. You have to understand that or anybody who's keen to run a hospital starts even a small hospital, instead of cribbing and complaining, he should look at the top guy and said, I want to get some of the quality and some of the services the way he's giving. Let me see what is within my means. So this. You have to keep a positive attitude, and you will grow. You have not been given funding. You have not been given money and you cannot build, the whole hospital in a day, right? But I've done it. I have proven it, and I'm willing to give the same answer to everybody. And you're asking about the amount, the second question. I think it should not discourage you if you start from a small setup. I mean, that's within your means. That's the kind of tension you want to take, and you don't have any other. I mean, you don't have to go for funding, because funding has its own problems, and we don't want to get into trouble halfway if things don't go right. The other thing is, in a city like Delhi, you would be spending on an average between 2 to 3 crores per bed. In a tier 3 town, I think you can do it in 20 lakhs or so. So it depends. You build a 5-bedded hospital, and you just need 1 crore for everything, which is I think doable. So and what speciality you are running? If you laparoscopy, minimally invasive surgery has changed the game. Now, most of the centers abroad, they are sending their patients by evening. Daycare. You don't need a bed. And even if you have 10 beds, probably you will be able to do great work if your specialty is basically such. And it's a question of what kind of. So it is very difficult to define the way you are asking questions. But yes, smaller centers are required. They are doing a good job. They will survive. You have to have confidence. And bigger ones are also needed, because they will show the way. Technology, kind of treatment, upgradation, patients coming, medical tourism, who will do? They will do.
That's my last question. My last question is, you are a doctor, you are a surgeon, you've studied for so many years, put in so much effort, and you're a fantastic, qualified person. Do you want to put your energy in running a hospital like a small business? Because actually, if you keep doing surgeries and do what you're doing best, you are somebody who can just do so much. Do you think I'm asking this because everybody is doing a business. You're trying to say electricity nahi hai, power nahi. You've been handling so many tough problems. Would it not be better at the end of your journey to feel, you could have reached so many places with being such fantastic doctors?
Okay, since you're told surgeon, I'm an anesthetist surgeon. Okay,
You're a doctor.
fine. No, see. First of all, you have to understand that at least in my generation or people who are there, when we joined MBBS, we never joined MBBS thinking that I'll build a 100-bedded hospital, earn 150 crores by when I was 40, 50 years. No. None of us think. Money is a byproduct. Okay, here we want to practice, most of them. Okay, fine, there are some black sheeps in any profession. Most of them practice it with a passion, actually. We could be able to see that passion in Sir's talk. Surgeons are always very passionate. Whether it be gynecologists or general surgeon, orthopedic, they're very passionate. So it is an art, kind of an art, actually. Okay, the money is a byproduct, actually. Okay. Probably, if Sir had worked in some big hospital just doing bariatric surgery, he would have done bariatric surgeries, done far more higher number of surgeries or complex surgeries. But the kind of satisfaction he has got today, actually, he has served the patient during COVID, and he is treating his staff as a family, actually. That kind of a satisfaction is what makes you as an entrepreneur. It's not that everyone can become an entrepreneur, need not be. If you do not have that kind of a mindset, working in a big hospital is very good, nothing wrong actually. See, thousands and thousands of doctors are coming out of Indian Medical College. Doesn't mean that everyone should open a hospital. People who have got the passion, courage, and resilience, they could start. And other people could work in a bigger hospital, do the clinical work, be happy with what you are doing. So that's what I'm just telling, that it depends on the individual person's passion and what they want. Ultimately, it's a purpose in life. What is the purpose in life? It is not building a 100-bedded hospital or 3,000-bedded hospital for me, or earning 50 crores or 100 crores or 200 crores. That can be a purpose also. For most of the doctors, the purpose is different. Practice my profession in a decent, nice place, ethically. That's what most of the doctors want to do and are doing that. That's what I would like to say on behalf of all the doctors.
Well, I don't have to say thank you so much.
Thank you, ma'am.
Thank you so much.
Is there any question from the audience? Yeah, please.
Thank you so much, sir, for the enlightening presentation. Do you see the India healthcare sector being shifted to developing more and more specialty centers? Like previously there are multi-specialty centers, but nowadays I'm mostly practicing in Tier 1 cities. So there are multiple specialty centers that are coming up, like specifically orthopedic center, a specific surgical or a minimal access center, or a big boom in gynae obs and maternal health change. Do you see this healthcare sector being shifted to specialty hospitals?
It's a part of evolution journey, actually. Basically, you see, one thing is necessity is the mother of invention. In bigger cities, you don't have place or you can't afford to have a place for 150-bedded multi-specialty hospital. That's why single specialty, that's what we are telling, the 10-bedded daycare center is also possible, actually. So that's why that becomes profitable and scalable. That's why single specialty centers are coming. Today you are a doctor, you want to become an entrepreneur. To begin with, a single specialty center is the best way to do. So it is going according to the market needs and people needs. As I said that patients need experiences in certain elective surgeries. These experiences can be given by single specialty center. For example, eye care. Eye care change have started coming in the last 10 years. Earlier it was not like that. Only charity hospitals were doing. So we can give a better experience in single specialty, but need not be. Say, if you see that trauma, critical care, transplants are also increasing. Those hospitals require multi-specialty center. So a new part evolving is also happening, and similarly tertiary care hospital is also evolving. So segmentation of the business is happening. Okay, it depends in what is your capability and interest. Accordingly, you choose that.
But what about the Tier 3 cities and those kind of cities?
Tier 3 cities, if you have seen those days itself, there are obstetric nursing homes, pediatric nursing homes. There have been single specialty there. But in a Tier 3 town, you can't afford to have a single specialty, orthopedic and other things. It is better to have few specialties or multi-specialty. That's what.
And to have a backup, we should always run an ICU or a critical care setup.
Possible. Right.
Thank you so much.
So you have given a very beautiful example of not having very high-end equipment, like the CT scan. You said a larger CT scan is not needed for a small healthcare hospital and it doesn't give an ROI. However, not all such facilities are rightly advertised. For instance, I being an orthopod is seeing a rise in the use of robotics. So from the patient point of view, they do not know whether a robotic joint replacement is actually better than a conventional joint replacement. How do you see a small scale or a medium scale hospital can overcome those challenges? Because investing on robotics is like a 5 to 10 crore additional cost with no extra ROI or added advantage even to the patient care. So how do you think we can overcome those challenges?
So I can say that we have 12 hospitals or multi-specialty hospitals. None of the hospitals has got robotic orthopedic surgery. We got robotic general surgery, 2 robotic robots we have, Da Vinci robots. We don't have an orthopedic. But we have got a very good orthopedic practice, joint replacement centers, we do surgeries, we do a lot actually. As sir did, if you see, sir has amazing marketing. Say he has shown photographs, videos of patients recovering, or weight reduction, or after 20 years someone is walking after some joint replacement or something is being done. So these kind of a patient education will ensure that you continue to get your own clientele. See, to be frank, it is a little bit unethical to say that robo could do everything. No, it is not like that. I feel that is unethical. The set of patients which require a robotic joint replacement surgery is very small. So if you educate the patients properly, then naturally without a very high-end gadgets, we will be able to manage.
Hello, why?
I would like to add that you see, we have to remember, we should not forget that industry pushes us into these directions. We have to educate ourselves and from our combined experiences decide what is good for you. If you are a kind of setup, who's banking on a lot of publicity. They need to run, get revenues. Patient is attracted, wanting robotic joint replacement. Probably you go for it. If another person, he says, I have such a good patient following, they have faith in me. I explain to them that knee robotic is no great deal because it is only guiding the surgeon what to do. The surgery will be done by me in any case, and if you don't have a good surgeon, he will not do a good robotic surgery. So you get the point? It's what narrative you build, and that narrative has to be according to your needs. So you do a right thing. If you're not doing a robotic joint, which is required only in very limited few cases, you're not doing anything unjust. You're just putting it right and explaining to the patient. Don't say whosoever is doing robotic is doing wrong. No, we are not there to judge anybody. We are there to put our narrative in front of what I feel is right. So both of them have a place. If you are not doing any, complex pelvic surgery, you don't even need a surgical Da Vinci, which is required only for limited cases. But you see, again, we are being pushed by the industry, and we get influenced. If you have the money, play. That's fine.
So I'm a fan of Android. I'm not a fan of Apple. I hate Apple because every year they come up with Apple 10, 11, 12, 13, 14. I don't know what number now they have. Tell me genuinely, have you seen any difference between 10 and 14? Nothing, actually. Okay, we make the same phone call, same watches, nothing difference. But that's what, as I said, industry has been pushing it. There's something called, this is all marketing technique, it's called FOMO, F-O-M-O, fear of missing out. They create something that if you don't have robo, or if you don't have this, you are not the right person, you are not the right surgeon. So that's the FOMO which this industry wants to create. Please don't fall for it.
Sir, my issue is, as you are running many hospitals, as a big nurse, sometimes the confusion comes that we should hire the land or we should partner the hospital with a financer or lender and then doctors. Because alone doctor hiring a land, building hospitals, running it brings a lot of, in this era, brings a lot of stress in your life and you become diseased also. So it's better to, what is the better in your opinion? To take on rented buildings and run the hospital or acquire your own buildings? What is?
Madam asked, say, what is the minimum amount required to start a hospital? If you have minimum funding, you take a rental building, do a hospital, run for a few years or so. Once you are confident, once your patients have confidence in you, then you can buy a place and build it actually, okay? So it depends upon your financial situation. To begin with, I would advise every entrepreneur to go for a rental place. That's what we did for first 10 years. We were there in a rental place. Then only we got our own building actually. In whichever new cities, we prefer to have a rental place because the capital investment is less, risks are less actually, okay? So that's very important actually, okay? So to begin with, a rental place is better, but as you grow big, the rental amount will grow also bigger. So it's better to own the place, provided you have enough financial capability to pay back them. So start with rental, and then depending upon your financial capability, you can own the center.
You have given lectures on so many topics. I suggest you one more lecture. That is how to deal with TPAs, how can we bring TPAs and all that. Because that is a very essential part of our medical.
I understand, sir.
Yeah.
So we haven't done, we'll do that. Yeah.
And one more thing, how can we take this Ayushman Bharat and all such things, CGHS, CCHS, in an ethical way, definitely not in an unethical way.
Yeah, sure, sir, definitely we do. We haven't done that.
You can then do that online also.
Yeah,
And
yeah, that's right.
thank you.